Today we're going to be talking to you about dressing apraxia and what all that entails. The objectives for this video are 1. Describing dressing apraxia, 2. Identifying the likely clients that it would present itself in, 3. Demonstrating the screening that we will be showing you later in a video, and 4. To discuss results with you. Dressing apraxia is the inability to dress oneself due to body schema disorder, or apraxia. Apraxia is often seen in other areas of function and should be assessed across multiple ADLs. Difficulty with dressing can result from 1. Ideational apraxia, which is a client who does not cognitively understand the demands of a task. An example of ideational apraxia could be an individual who does not understand that a shirt is an article of clothing to be worn on the torso and upper extremities. So they could put it on their legs, they could put it on backwards, something like that. Ideomotor apraxia is the loss of motor plan due to dress or retains motor plan but cannot access it. An example of ideomotor apraxia is an individual cognitively understands that pants go on their legs, however, accesses an inappropriate motor plan or cannot access the motor plan to put the pants on. So sometimes they just get stuck and they have the inability to actually put the clothes on even though they understand what they need to do. They may be able to automatically perform a dressing task when not instructed to do so. Likely clients would be clients who have suffered a CVA, a TBI, who have unilateral neglect or other neurological or brain damage.
The best time to do a screening for any form of apraxia is to observe the client during their morning ADL routine of getting dressed and grooming. This is convenient for both the client and for the practitioner because they would be getting dressed and getting ready for the day regardless. You can do this by observing the patient getting dressed, just watching the process and the motor movements of how they do that. If they struggle to get dressed independently, it is likely that they possibly have dressing apraxia. You can also do a little bit more of a formal screen by placing objects in front of the client that they would use for daily activities or for their morning ADLs and instruct them to demonstrate what to do with the object. In the following video, we will demonstrate this screen with a patient who has had a stroke. So Miss Lytle is a patient who has had a stroke, and we want to assess her for dressing and motor apraxia. So we have various items that we can use that would be a part of her morning routine, her ADL routine. We have a toothbrush, we have a jacket, a comb, her watch, some makeup, some lip gloss, and also this wouldn't necessarily be a part of her morning routine, but it is a good tool to use, a letter and an envelope of what you would do with these items. So we're not going to use each of these tools for the sake of time, but we're going to demonstrate how you might perform this assessment. So Mrs. Lyle, would you please show me what you do with this tool? Okay. Alrighty. And how about, can you put this on for me?
Yes.
All right, well, thank you so much. You could see in the video, Miss Lytle struggled with several of her morning ADL tasks. Apraxia is indicated if the client shows difficulty getting dressed independently, as you saw with her trying to put on her coat. It appeared that Miss Lytle knew where the coat was to go and cognitively understood that it was a jacket. However, she did not have the motor plan to complete the activity. Also, you will see a client using tools inappropriately. For example, in the video, you saw Miss Lytle using a toothbrush to brush her hair rather than brushing her teeth. This is because she's accessing a different motor plan rather than toothbrushing. If your client is unable to demonstrate the appropriate motor plans, it's also likely that apraxia is indicated. A more objective way to measure this is to present the client with several different opportunities to demonstrate motor plans, and if they do it incorrectly 3 out of 4 times, apraxia is indicated. Dressing apraxia is commonly seen and treated by OT. If a client is struggling to dress independently due to difficulty motor planning the movements, it is likely that they have dressing apraxia. This is something that we as clinicians should be prepared to assess and address in treatment. Thank you so much for watching this presentation.